Question 1. Performance analysis shows that during a group training session focused on leash manners, a previously well-behaved dog begins to exhibit excessive lip licking and yawning, which are recognized displacement behaviors indicating stress. The dog is in a controlled environment with other dogs present, and the trainer is demonstrating a new walking technique. The dog is not showing aggression or any immediate danger to itself or others. What is the most appropriate immediate course of action for the professional dog trainer? Option A. Continue with the demonstration of the new walking technique, assuming the dog will eventually habituate to the stress and settle down. Option B. Gently but firmly correct the dog's displacement behaviors, such as lip licking, to discourage them from occurring during training. Option C. Immediately halt all training and send the dog and owner home, as the dog is clearly not coping with the group environment. Option D. Temporarily remove the dog from the immediate training area to a quiet, safe space, allowing it to decompress, and then reintroduce it to a less stimulating aspect of the training or a different activity once it is calmed. The correct answer is D. Temporarily remove the dog from the immediate training area to a quiet, safe space, allowing it to decompress, and then reintroduce it to a less stimulating aspect of the training or a different activity once it is calmed. Explanation. This scenario presents a professional challenge because it requires a trainer to balance the immediate needs of a distressed dog with the long-term goal of behavior modification, while adhering to ethical guidelines and best practices for animal welfare. The dog's displacement behavior, while a sign of stress, is not inherently dangerous, but indicates an underlying emotional state that needs careful management. The trainer must avoid exacerbating the stress or creating new behavioral issues. The correct approach represents best professional practice because it prioritizes de-escalation and management of the dog's emotional state before attempting to address the root cause of the stress. This aligns with the Association of Professional Dog Trainers, APT, Code of Ethics, which emphasizes humane treatment, avoidance of fear and pain, and a focus on positive reinforcement. By redirecting the dog to a less stimulating activity and providing a safe space, the trainer is managing the immediate stress response, which is crucial for the dog to be receptive to learning. This approach respects the dog's current emotional capacity and lays the groundwork for future training without causing further distress. An incorrect approach that involves immediately forcing the dog into the situation that triggers the displacement behavior is ethically unsound and likely to worsen the dog's stress and anxiety. This could lead to an escalation of the behavior, potentially resulting in a more severe reaction, and violates the APT commitment to avoiding fear and distress. Another incorrect approach, such as ignoring the displacement behavior and continuing with the original training plan, demonstrates a lack of understanding of canine stress signals and a failure to adapt to the dog's needs. This can lead to the dog becoming more overwhelmed and less likely to learn, potentially damaging the trainer-client relationship and the dog's trust in the trainer. A third incorrect approach, which involves punishing the displacement behavior, is a direct violation of humane training principles and APT ethical standards. Punishment can suppress behaviors without addressing the underlying cause, increase fear and anxiety, and lead to a breakdown in communication and trust between the dog and the trainer. Professionals should use a decision-making framework that begins with observing and interpreting the dog's body language and behavior. When stress signals like displacement behaviors are observed, the immediate priority is to reduce that stress. This involves assessing the environment and the training activity for potential triggers. The next step is to implement management strategies that lower the dog's arousal and provide a sense of safety. Only after the dog has calmed down and is in a more receptive state should the trainer consider reintroducing the training or addressing the underlying issues, always using positive, force-free methods. This iterative process of observation, assessment, management, and gradual reintroduction is key to effective and ethical dog training. Question 2. System analysis indicates that a client's dog barks excessively at the mail carrier. The client wants the barking to stop immediately. Which of the following approaches best aligns with the ethical and professional standards of the Association of Professional Dog Trainers certification? Option A. Implement a training plan that uses positive reinforcement to teach the dog to perform a quiet cue or go to a designated mat when the mail carrier approaches, while simultaneously managing the environment to reduce the dog's arousal. Option B. Apply a mild electric shock via a remote collar when the dog barks, as this is a highly effective method for immediate behavior cessation. Option C. Advise the client to simply ignore the barking, as it will eventually extinguish on its own without any active intervention. Option D. Immediately use a spray bottle filled with water to startle the dog each time it barks at the male carrier, aiming to suppress the barking through aversive consequence. The correct answer is A. Implement a training plan that uses positive reinforcement to teach the dog to perform a quiet cue or go to a designated mat when the male carrier approaches, while simultaneously managing the environment to reduce the dog's arousal. Explanation. Scenario analysis. This scenario presents a common challenge in professional dog training, where a trainer must adapt their operant conditioning techniques to address a specific behavioral issue while adhering to ethical guidelines and client expectations. The challenge lies in selecting the most effective and humane intervention that aligns with established professional standards and avoids potential negative consequences for the dog or the client relationship. Correct approach analysis. The correct approach emphasizes understanding the underlying function of the behavior and applying positive reinforcement to teach an alternative, incompatible behavior. This aligns with the core principles of ethical dog training, which prioritize the dog's welfare and aim to build a strong, positive relationship between the dog and owner. Professional dog training organizations, such as the Association of Professional Dog Trainers, APT, advocate for science-based, humane training methods that rely on positive reinforcement and avoidance of punishment-based techniques that can lead to fear, anxiety, or aggression. This approach is not only effective in modifying behavior, but also promotes a cooperative learning environment, which is a hallmark of professional practice. Incorrect approaches analysis. One incorrect approach involves the immediate application of aversive stimuli to suppress the behavior. This fails to address the root cause of the barking and can lead to the dog experiencing fear, anxiety, or pain. Ethically, this violates the principle of do no harm and is contrary to the humane training standards promoted by professional organizations. It can also create new behavioral problems or exacerbate existing ones, leading to a breakdown in the human-animal bond and potential legal or ethical complaints. Another incorrect approach focuses solely on punishment without understanding the antecedent or consequence that maintains the behavior. This is a superficial intervention that does not teach the dog what to do instead. It is ethically problematic as it relies on creating an unpleasant experience for the dog without providing a clear, positive alternative. This can lead to the dog becoming less likely to engage in the unwanted behavior in the presence of the punisher, but does not generalize to other situations and can lead to suppression of other behaviors. A third incorrect approach involves ignoring the behavior with the hope that it will extinguish on its own, without any intervention. While extinction is a valid operant conditioning principle, it requires that the behavior is no longer reinforced. In many cases, behaviors like barking are reinforced by attention, even negative attention, or by achieving a desired outcome, e.g., the perceived threat leaving. Simply ignoring the behavior without understanding its function or implementing a plan to manage the environment or teach an alternative can lead to the behavior persisting or even escalating. This approach lacks proactive problem solving and can be seen as neglecting the client's concerns and the dog's welfare. Professional reasoning. Professionals must first conduct a thorough assessment to understand the function of the behavior. This involves identifying what triggers the behavior and what the dog gains from it. Based on this assessment, the trainer should develop a behavior modification plan that utilizes positive reinforcement to teach an alternative, incompatible behavior. This plan should be clearly communicated to the client, with realistic expectations set for the training process. Continuous monitoring and adjustment of the plan are crucial, always prioritizing the dog's welfare and the client's ability to implement the training effectively. This systematic, ethical, and welfare-focused approach ensures the best possible outcome for both the dog and the owner. Question 3. The evaluation methodology shows a dog exhibiting aggressive behaviors towards its owner when approached during feeding. Which approach best aligns with a professional, risk-informed assessment and intervention strategy for this situation? Option A. Advise the owner to simply avoid the dog during feeding times and hope the behavior resolves on its own. Option B. Immediately implement a strict feeding routine with aversive tools to assert dominance and prevent future aggression. Option C. Recommend immediate euthanasia of the dog due to the perceived severity of the aggression. Option D. Conduct a thorough assessment of the dog's history, environment, and specific triggers for aggression around food, followed by a tailored, humane behavior modification plan that prioritizes safety. The correct answer is B. Immediately implement a strict feeding routine with aversive tools to assert dominance and prevent future aggression. Explanation: this scenario is professionally challenging because aggression in dogs presents a significant safety risk to the trainer, the client, other animals, and the public. A thorough risk assessment is paramount to ensure the safety and well-being of all involved, and to comply with professional standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation that considers the dog's history, environmental factors, and the specific triggers for aggression. This aligns with the ethical obligation of a professional dog trainer to act in the best interest of the animal and its handlers, while mitigating risks. It also reflects the understanding that aggression is a complex behavior with multiple contributing factors, requiring a nuanced approach rather than a single solution fix. This methodology ensures that interventions are tailored to the individual dog and situation, promoting effective and safe behavior modification. An incorrect approach that focuses solely on immediate suppression of the aggressive behavior without understanding its root cause is ethically and professionally deficient. It fails to address the underlying issues, potentially leading to the aggression manifesting in different, possibly more dangerous ways, or becoming more ingrained. This approach could also be seen as neglecting the trainer's duty of care to the client and the dog, as it does not aim for long-term, sustainable behavior change. Furthermore, it may violate guidelines that emphasize humane and science-based training methods, as it could lead to the use of aversive techniques that exacerbate fear and anxiety, thereby increasing aggression. Another incorrect approach that relies on anecdotal evidence or generalized advice without a specific assessment of the individual dog's situation is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to adhere to the principles of individualized assessment, which is a cornerstone of effective behavior modification. Such an approach could lead to inappropriate or ineffective interventions, potentially worsening the problem and creating liability for the trainer. It also undermines the credibility of the profession by suggesting that a one-size-fits-all solution exists for complex behavioral issues like aggression. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with gathering a detailed history from the owner, observing the dog's behavior in various contexts, identifying specific triggers and antecedents of aggression, and assessing the dog's overall physical and emotional state. Based on this comprehensive evaluation, the trainer can then develop a tailored behavior modification plan that prioritizes safety, uses humane and evidence-based techniques, and involves ongoing monitoring and adjustment. Collaboration with veterinary professionals may also be necessary to rule out underlying medical conditions contributing to the aggression. Question 4. Compliance review shows a professional dog trainer is working with a client who has acquired a young border collie. The client expresses concern that the dog has an excessive amount of energy and is constantly seeking something to do, sometimes exhibiting nipping at heels when bored. The trainer is considering the best course of action to address these concerns while ensuring the dog's welfare and the client's satisfaction. Which approach best aligns with professional best practices for working breeds? Option A. Advise the client that border collies are naturally high energy and that the client simply needs to toughen up and accept the dog's behavior as typical for the breed. Option B. Focus solely on basic obedience commands and impulse control exercises, assuming that mastering these will naturally manage the dog's energy and drive. Option C. Recommend a comprehensive training program that includes advanced obedience, scent work, and agility, emphasizing the importance of consistent daily engagement and mental stimulation tailored to the border collie's inherent drives, while also assessing the client's capacity and commitment to these activities. Option D. Suggest that the client enroll the dog in a local herding trial immediately, without assessing the dog's readiness or the client's experience with such activities. The correct answer is C. Recommend a comprehensive training program that includes advanced obedience, scent work, and agility, emphasizing the importance of consistent daily engagement and mental stimulation tailored to the border collie's inherent drives, while also assessing the client's capacity and commitment to these activities. Explanation: this scenario presents a professional challenge because it requires a trainer to balance the inherent needs and predispositions of a working breed with the expectations and lifestyle of a pet owner. Working breeds, by their nature, possess strong drives for tasks such as herding, guarding, or retrieving, which, if not appropriately channeled, can manifest as undesirable behaviors in a domestic setting. The trainer must assess the owner's capacity and commitment to meet these needs while ensuring the dog's welfare and safety, and that of the public. This requires a deep understanding of breed-specific traits, effective behavior modification techniques, and clear communication with the client. The correct approach represents best professional practice because it prioritizes the dog's welfare and the safety of the public by acknowledging the breed's specific needs and the owner's limitations. It involves a comprehensive assessment of the owner's lifestyle, experience, and willingness to engage in appropriate training and enrichment activities tailored to a working breed. This proactive and individualized approach ensures that the training plan is realistic, sustainable, and addresses potential behavioral challenges before they escalate. It aligns with the ethical obligation of professional dog trainers to promote responsible pet ownership and to ensure that dogs are placed in environments where their needs can be met, thereby preventing potential abandonment or reharming due to unmanaged behavioral issues. This also implicitly supports the principles of humane training and the prevention of cruelty by ensuring the dog's physical and mental well-being. An incorrect approach that focuses solely on basic obedience without considering the working breed's inherent drives fails to address the root causes of potential behavioral issues. This is a regulatory and ethical failure because it neglects the trainer's responsibility to understand and manage breed-specific needs, potentially leading to frustration for both the dog and the owner, and increasing the likelihood of behavioral problems. Such an approach could be seen as negligent in its duty of care. Another incorrect approach that involves recommending intense, specialized working dog activities without a thorough assessment of the owner's capacity or the dog's suitability for such activities is also a failure. This is an ethical lapse as it could place undue stress on the dog and owner and potentially lead to injury or burnout. It also fails to consider the practical realities of the owner's life and could result in the dog not receiving the necessary outlets, leading to frustration and behavioral issues. A third incorrect approach that dismisses the owner's concerns about the dog's energy levels and drive, attributing them solely to owner error, is a significant professional and ethical failure. This demonstrates a lack of empathy and a failure to collaborate with the client. It neglects the trainer's role in educating and supporting the owner, and instead creates an adversarial relationship, undermining the effectiveness of any training. This approach fails to uphold the professional standard of client-centered care and effective communication. The professional decision-making process for similar situations should involve a thorough initial consultation that includes understanding the owner's experience, lifestyle, and expectations, alongside a detailed assessment of the dog's breed, age, temperament, and any existing behavioral concerns. The trainer must then develop a personalized training plan that is realistic for the owner and appropriate for the dog's breed-specific needs, emphasizing clear communication, education, and ongoing support. This process ensures that the training is effective, ethical, and promotes a harmonious relationship between the dog and its owner. Question 5. Implementation of a comprehensive training plan for a young Labrador Retriever exhibiting strong retrieving instincts and a tendency to mouth objects inappropriately, considering the owner's desire for a well-behaved family pet and their limited experience with sporting breeds. Option A. Recommend that the owner limit the dog's exercise to short, infrequent walks and discourage any retrieving activities to prevent the dog from developing its natural instincts, prioritizing a calm household over breed-specific needs. Option B. Develop a training program that incorporates structured retrieving games, positive reinforcement for appropriate toy play, and redirection techniques when mouthing is undesirable, alongside consistent basic obedience training and ample opportunities for physical exercise. Option C. Implement a strict no-chew policy using deterrent sprays on all household items and immediately scolding the dog with a harsh vocalization whenever it attempts to mouth anything other than its designated toys. Option D. Focus exclusively on teaching the dog to leave it and drop it commands, assuming that mastering these commands will eliminate all undesirable mouthing behaviors without addressing the underlying drive. The correct answer is B. Develop a training program that incorporates structured retrieving games, positive reinforcement for appropriate toy play, and redirection techniques when mouthing is undesirable, alongside consistent basic obedience training and ample opportunities for physical exercise. Explanation: this scenario presents a professional challenge due to the inherent drive and specific needs of sporting breeds, which can lead to frustration and potential behavioral issues if not properly channeled. The trainer must balance the dog's natural instincts with the owner's lifestyle and the dog's safety and well-being, all while adhering to professional standards and ethical guidelines. Careful judgment is required to select training methods that are effective, humane, and appropriate for the breed's genetic predispositions. The correct approach represents best professional practice because it prioritizes a holistic understanding of the sporting breed's needs, integrating physical exercise, mental stimulation, and breed-specific training techniques. This aligns with the Association of Professional Dog Trainers, APT Code of Ethics, which emphasizes humane training methods, understanding canine behavior, and promoting the welfare of the dog. By focusing on positive reinforcement and management strategies that address the dog's natural retrieving and working drives, the trainer is fostering a well-adjusted companion while respecting the breed's heritage. This approach also empowers the owner with knowledge and skills to manage the dog effectively in various environments, promoting a strong human-animal bond. An incorrect approach that relies solely on punishment or suppression of natural behaviors is professionally unacceptable. This fails to acknowledge the breed's genetic makeup and can lead to fear, anxiety, and aggression, violating the apt commitment to humane treatment and the prevention of harm. Another incorrect approach that neglects adequate physical and mental exercise, focusing only on basic obedience, would fail to meet the high energy and stimulation needs of sporting breeds, potentially resulting in destructive behaviors or frustration. This demonstrates a lack of understanding of breed-specific requirements and a failure to provide comprehensive training solutions. An approach that solely focuses on the owner's convenience without considering the dog's welfare would also be ethically unsound, prioritizing human needs over canine well-being. Professionals should approach such situations by first conducting a thorough assessment of the dog's breed, age, temperament, and the owner's goals and lifestyle. This assessment should inform the development of a customized training plan that incorporates breed-appropriate activities, positive reinforcement techniques, and effective management strategies. Continuous evaluation and adaptation of the plan based on the dog's progress and the owner's feedback are crucial. Professionals must also educate owners about their dog's specific needs and provide them with the tools and knowledge to manage their dog successfully long-term, always prioritizing the dog's welfare and promoting responsible pet ownership. Question 6. The assessment process reveals that a litter of 3-day-old puppies under the care of a new breeder client exhibits inconsistent suckling patterns and occasional lethargy, which deviate from the breeder's expectations of robust neonatal activity. As a certified professional dog trainer, what is the most appropriate initial risk assessment and action? Option A suggests that the puppies are likely experiencing normal variations in neonatal development and that their behavior will likely self-correct as they mature. Option B, advise the client to monitor the puppies closely for any worsening of symptoms and to consult a veterinarian immediately if the lethargy increases or if any new concerning signs appear. Option C, recommend specific nutritional supplements and a feeding schedule designed to boost the puppy's energy levels and improve suckling strength. Option D, attempt to implement gentle massage techniques and environmental enrichment activities to stimulate the puppies and encourage more consistent suckling. The correct answer is B. Advise the client to monitor the puppies closely for any worsening of symptoms and to consult a veterinarian immediately if the lethargy increases or if any new concerning signs appear. Explanation: the assessment process reveals a common challenge for professional dog trainers, identifying and addressing potential developmental issues in neonatal puppies without overstepping the boundaries of their expertise or compromising the health and well-being of the puppies. This scenario requires a delicate balance between observation, knowledge of normal neonatal development, and understanding the scope of practice for a certified professional dog trainer. The trainer must recognize signs that might indicate a deviation from typical development, but also understand when to defer to veterinary professionals. The correct approach represents best professional practice because it prioritizes the puppy's health and safety by involving a veterinarian, who is the qualified expert for diagnosing and treating medical conditions. This aligns with the ethical guidelines of the Association of Professional Dog Trainers, APT, which emphasize working within one's scope of competence and collaborating with other professionals when necessary. Specifically, apt Code of Ethics stresses the importance of client education and referral to appropriate professionals for issues beyond the trainer's expertise, such as health concerns. An incorrect approach that involves attempting to diagnose or treat the observed issue without veterinary consultation is a significant regulatory and ethical failure. This could lead to misdiagnosis, delayed treatment, or inappropriate interventions, potentially harming the puppy and violating the apt commitment to the welfare of animals. Another incorrect approach, such as ignoring the observation entirely, fails to uphold the trainer's responsibility to advocate for the animal's well-being and could be seen as negligence. Finally, an approach that focuses solely on behavioral modification techniques without considering underlying health issues is also a failure, as it neglects the fundamental principle that behavior is often influenced by physical health. The professional decision-making process for similar situations should involve a systematic risk assessment. First, observe and document the specific behaviors or physical signs. Second, compare these observations against established norms for neonatal puppy development. Third, determine if the observations fall within the scope of a dog trainer's expertise or if they suggest a potential health concern requiring veterinary attention. Fourth, if a health concern is suspected, the immediate and primary professional action is to advise the client to consult a veterinarian. Communication with the client should be clear, empathetic, and focused on the puppy's welfare, emphasizing the need for professional veterinary assessment. Question 7. Investigation of a client's report of their dog exhibiting repetitive, seemingly purposeless tail-chasing behavior during greetings, requiring a comparative analysis of potential underlying causes and appropriate professional responses within the apt framework. Option A. Conduct a thorough behavioral assessment, considering the frequency, intensity, context, and impact of the tail chasing, and develop a positive reinforcement-based behavior modification plan in collaboration with the client. Option B. Immediately implement aversive techniques to suppress the tail chasing behavior, as it is clearly an undesirable and potentially compulsive action. Option C. Recommend a drastic change in the dog's diet and exercise routine without further behavioral evaluation, assuming a nutritional deficiency is the sole cause. Option D. Advise the client that the behavior is likely just excitement and requires no specific intervention, as long as it doesn't cause physical harm. Correct answer is A. Conduct a thorough behavioral assessment, considering the frequency, intensity, context, and impact of the tail chasing, and develop a positive reinforcement-based behavior modification plan in collaboration with the client. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a dog trainer to differentiate between a normal, albeit enthusiastic, greeting behavior and a potentially compulsive behavior that could escalate or indicate underlying anxiety. Misinterpreting the behavior could lead to ineffective training, client frustration, and a failure to address the dog's welfare. The trainer must consider the dog's history, the context of the behavior, and the potential impact on the dog's quality of life and the client's ability to manage the dog. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the frequency, intensity, duration, and context of the behavior, alongside the dog's overall emotional state and the impact on its daily functioning. This aligns with the Association of Professional Dog Trainers, apt Code of Ethics, which emphasizes understanding the individual animal and employing humane, science-based training methods. It also reflects a commitment to client education and collaborative problem-solving, ensuring the client understands the behavior and the proposed intervention. This approach prioritizes the dog's welfare and the client's ability to manage the situation effectively. Incorrect approaches analysis. One incorrect approach involves immediately labeling the behavior as obsessive-compulsive and recommending drastic, potentially aversive, interventions without thorough assessment. This violates the apt ethical guidelines by potentially causing undue stress or fear to the dog, and failing to explore less intrusive, more positive methods first. It also bypasses the crucial step of understanding the behavior's function and triggers. Another incorrect approach is to dismiss the behavior as simply excitement and offer no further guidance or intervention. This fails to acknowledge the client's concern and the possibility of an underlying issue. Ethically, trainers have a responsibility to address client concerns and provide appropriate guidance, even if the behavior doesn't immediately appear severe. Ignoring it could lead to the behavior worsening or the client seeking unqualified advice. A third incorrect approach is to focus solely on suppressing the behavior through punishment-based methods. This is contrary to modern, ethical dog training principles supported by the APT, which advocate for positive reinforcement and understanding the root cause of behaviors. Aversive methods can suppress outward signs of distress without addressing the underlying anxiety or compulsion, potentially leading to redirected or more severe behavioral issues. Professional reasoning. Professionals should approach such situations by first gathering detailed information from the client about the behavior's history, triggers, and the dog's general demeanor. This is followed by direct observation of the dog in various contexts. Based on this comprehensive assessment, the trainer can then formulate a behavior modification plan that is humane, effective, and tailored to the individual dog and client. Open communication and collaboration with the client are paramount throughout the process. Question 8. Market research demonstrates that clients often seek professional dog trainers to address behavioral issues stemming from stress. During a basic obedience session, a trainer is working with a dog on a sit cue. The dog performs the cue correctly, but then exhibits a quick, brief lip lick. The trainer has observed this dog to be generally eager to please, but can become anxious in new environments. What is the most appropriate immediate response for the professional dog trainer? Option A. Briefly pause the exercise, offer a calming cue or a moment of quiet, and then resume the exercise at the same level if the dog appears settled. Option B. Immediately increase the difficulty of the sit cue or introduce a more complex command to challenge the dog and build confidence. Option C. Administer a mild reprimand or correction for the lip lick, as it may be interpreted as a sign of defiance or distraction. Option D. Continue with the next cue in the training sequence without acknowledging the lip lick, assuming it is a minor or irrelevant behavior. The correct answer is A. Briefly pause the exercise, offer a calming cue or a moment of quiet, and then resume the exercise at the same level if the dog appears settled. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a trainer to interpret subtle canine body language in a dynamic, potentially stressful environment. Misinterpreting signals can lead to inappropriate training interventions, escalating stress, or missed opportunities for positive reinforcement, all of which can impact the dog's welfare and the client's trust. The trainer must balance immediate behavioral observation with long-term training goals and the dog's emotional state. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the dog's welfare by accurately identifying and responding to stress signals. Recognizing a lip lick as a sign of mild stress and offering a brief pause and a calming cue demonstrates an understanding of canine communication and a commitment to positive, low-stress training methods. This aligns with the ethical guidelines of the Association of Professional Dog Trainers, APT, which emphasize humane treatment and the avoidance of causing undue stress or fear in dogs. It also reflects a proactive approach to training, preventing potential escalation of stress. Incorrect approaches analysis. One incorrect approach involves ignoring the lip lick and continuing with the cue. This is a regulatory and ethical failure because it disregards a clear signal of discomfort from the dog. It can be interpreted as a failure to uphold the APT commitment to humane training and could lead to the dog becoming more stressed, potentially developing avoidance behaviors or exhibiting more overt stress signals. This approach prioritizes the trainer's agenda over the dog's immediate needs. Another incorrect approach is to immediately punish the dog for the lip lick. This is a significant regulatory and ethical failure. Punishing a stress signal is counterproductive and harmful. It teaches the dog that expressing discomfort is wrong, which can suppress important communication signals and lead to more severe behavioral issues. This directly violates the principles of positive reinforcement and humane treatment advocated by the APT. A further incorrect approach is to assume the lip lick is a sign of excitement and to increase the intensity of the training exercise. This demonstrates a fundamental misunderstanding of canine stress signals and is an ethical failure. Misinterpreting a stress signal as excitement can lead to the dog being pushed beyond its comfort zone, increasing anxiety, and potentially causing a breakdown in the training session or the development of negative associations with the training. Professional reasoning. Professionals should employ a decision-making framework that begins with keen observation of the dog's entire body language, not just isolated signals. When a potential stress signal like a lip lick is observed, the trainer should pause, assess the context, and consider the dog's overall demeanor. The next step is to evaluate the dog's threshold for stress and adjust the training accordingly. This might involve reducing the difficulty of the cue, increasing the distance, providing a break, or reinforcing a calmer state. The trainer should always prioritize the dog's emotional well-being and use this information to inform their training strategy, ensuring a positive and effective learning experience. Question 9. Process analysis reveals that a new client is eager for their dog to learn a specific trick quickly. They have heard about clicker training and want to implement it immediately. The trainer needs to decide on the most effective and ethical initial steps for introducing the clicker. Which approach best aligns with professional standards for clicker training and the welfare of the dog? Option A. First, establish a strong association between the clicker sound and a high-value treat, ensuring the dog understands the clicker predicts a reward before introducing any specific cues or behaviors. Option B. Begin clicking and rewarding the dog for performing the trick, but only after the owner has repeatedly given the verbal cue multiple times. Option C. Immediately begin clicking and rewarding the dog every time it performs the desired trick, even if the dog is not fully grasping the cue. Option D. Use the clicker to mark the dog's attempt at the trick, and if the dog doesn't perform it correctly, immediately apply a mild leash correction. Correct answer is A. First, establish a strong association between the clicker sound and a high-value treat, ensuring the dog understands the clicker predicts a reward before introducing any specific cues or behaviors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a trainer to balance the immediate desire for a quick fix with the long-term welfare and ethical considerations of the dog. The trainer must assess the dog's individual learning style, emotional state, and potential for stress or anxiety, rather than solely focusing on the owner's perceived need for rapid results. The pressure from an owner to achieve a specific outcome quickly can lead to the temptation to use methods that might be faster but are ethically questionable or detrimental to the dog's well-being. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the dog's welfare and adheres to the ethical guidelines of the Association of Professional Dog Trainers (APT). The APT Code of Ethics emphasizes humane training methods, positive reinforcement, and the avoidance of fear, intimidation, or punishment. By focusing on building a positive association with the clicker and gradually introducing the cue, the trainer is employing a scientifically sound and ethically responsible method that respects the dog's learning process and builds a strong foundation of trust and understanding. This approach aligns with the APT commitment to promoting effective and humane dog training. Incorrect approaches analysis. One incorrect approach involves immediately associating the clicker with a command without establishing a clear understanding of the clicker's meaning. This can lead to confusion for the dog, potentially causing frustration and anxiety, which is a failure to uphold the APT ethical standard of avoiding methods that cause distress. It also bypasses the crucial step of charging the clicker, which is fundamental to effective clicker training and can undermine the entire process. Another incorrect approach is to use the clicker to mark and immediately reward a desired behavior that the dog has not yet reliably learned or understood. This can result in the dog performing the behavior inconsistently or performing it for the wrong reasons, leading to a breakdown in communication and a potential increase in the dog's stress levels. This approach fails to demonstrate competence in applying clicker training principles and could be seen as a breach of professional responsibility to provide effective training. A third incorrect approach involves using the clicker to mark and then immediately applying a correction if the dog does not perform the desired behavior. This directly contradicts the core principles of positive reinforcement and humane training that are central to the APT ethical framework. It introduces punishment into a system designed for positive association, which can create fear and aversion towards both the trainer and the training process, severely damaging the dog's trust and willingness to learn. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the dog's individual needs and the owner's goals. This assessment should then be filtered through the lens of established ethical guidelines and best practices, such as those provided by the APT. When faced with pressure for rapid results, the professional must remain grounded in their knowledge of learning theory and ethical responsibilities, prioritizing the long-term welfare and understanding of the dog over short-term gains. This involves clear communication with the owner about the training process, setting realistic expectations, and educating them on the importance of humane methods. Question 10. System analysis indicates a client is seeking assistance for their dog, a 3-year-old Labrador, who has recently begun to vocalize excessively when left alone for short periods. The owner reports the vocalizations are a mix of whining and barking, and they are concerned about disturbing neighbors. They have tried leaving the dog with toys, but the vocalizations persist. The owner is asking for the quickest way to stop the noise. What is the most ethically and professionally responsible course of action for the trainer? Option A. Recommend that the owner leave the dog with a radio playing loudly and a high-value chew toy, and if the vocalizations continue, to consider crating the dog for longer periods. Option B. Suggest that the owner ignore the vocalizations completely, as the dog is likely just seeking attention and will eventually stop if not rewarded. Option C. Advise the owner to use a citronella collar or a vibration collar to deter the dog from vocalizing when left alone, as this will quickly address the noise issue. Option D. Recommend a comprehensive behavioral assessment to identify the underlying cause of the separation-related vocalizations and develop a humane, gradual desensitization and counter-conditioning plan, while also advising the owner to consult a veterinarian to rule out any medical issues. The correct answer is D. Recommend a comprehensive behavioral assessment to identify the underlying cause of the separation-related vocalizations and develop a humane, gradual desensitization and counter-conditioning plan, while also advising the owner to consult a veterinarian to rule out any medical issues. Explanation. This scenario presents a common ethical dilemma for professional dog trainers, specifically concerning vocalizations. The challenge lies in balancing the dog's welfare with the owner's expectations and the trainer's professional obligations. A trainer must assess the underlying cause of the vocalization, which could range from anxiety and fear to attention-seeking or medical issues, and then recommend an appropriate, humane, and effective intervention strategy. The trainer's responsibility extends beyond simply stopping the behavior. It involves understanding its function and addressing the root cause ethically and effectively, adhering to the apt code of ethics which emphasizes humane treatment and avoidance of harm. The correct approach prioritizes the dog's well-being and employs evidence-based, humane training methods. This involves a thorough assessment of the dog's environment, history, and the context of the vocalizations. It then leads to a tailored plan that addresses the underlying emotional state or unmet need driving the vocalization, rather than merely suppressing the symptom. This aligns with the apt commitment to positive reinforcement and force-free methods, ensuring the dog's psychological and physical safety. An incorrect approach that focuses solely on punishment or suppression without understanding the cause is ethically and professionally unsound. Such methods can exacerbate underlying anxiety or fear, leading to a worsening of the problem or the development of new behavioral issues. This violates the apt ethical guidelines against causing fear, intimidation, or distress. Another incorrect approach might be to dismiss the owner's concerns or the dog's vocalizations as normal, failing to provide professional guidance and potentially neglecting a sign of distress or an underlying issue that could be addressed. This demonstrates a lack of professional diligence and commitment to client service. Third incorrect approach could involve recommending methods that are not scientifically supported or that could be detrimental to the dog's welfare, such as those relying on aversive stimuli, which directly contravene the principles of humane training and the apt ethical framework. Professionals should approach such situations by first conducting a comprehensive behavioral assessment. This includes gathering detailed history from the owner, observing the dog in its environment, and identifying the triggers and consequences of the vocalizations. Based on this assessment, the trainer should then formulate a humane, evidence-based intervention plan that addresses the root cause. This plan should be clearly communicated to the owner, with realistic expectations set. If the vocalizations are suspected to have a medical component, the trainer must ethically recommend a veterinary consultation. The decision-making process should always be guided by the apt code of ethics, prioritizing the dog's welfare and the client's understanding and cooperation. Question 11. The analysis reveals that a client has adopted a young French bulldog and is eager to begin agility training. The trainer is aware that French bulldogs are a brachycephalic breed with potential respiratory and heat intolerance issues. Considering the association of professional dog trainers, APT, Code of Ethics and Best Practices in Canine Welfare. Which of the following approaches best addresses the client's enthusiasm while prioritizing the dog's anatomical and physiological needs? Option A. Recommend a high-intensity agility program, assuming the dog will adapt over time and that proper conditioning will mitigate any potential risks. Option B. Advise the client that agility training is not suitable for French bulldogs due to their breed characteristics and suggest alternative, less physically demanding activities. Option C. Immediately begin a rigorous agility training program as the dog is young and energetic and the client is highly motivated. Option D. Discuss the client's goals and then propose a modified training plan that incorporates short, low-impact sessions, emphasizes mental stimulation, and includes frequent breaks, especially in warmer conditions, while educating the client on breed-specific limitations. The correct answer is C. Immediately begin a rigorous agility training program as the dog is young and energetic and the client is highly motivated. Explanation. The analysis reveals a scenario where a professional dog trainer must interpret and apply knowledge of basic canine anatomy and physiology in the context of client communication and training plan development. This is professionally challenging because it requires not only accurate scientific understanding, but also the ability to translate that understanding into practical, client-friendly advice that respects the dog's physical limitations and promotes well-being. Misinterpreting anatomical or physiological factors can lead to ineffective training, potential injury, or a breakdown in client trust. The correct approach represents best professional practice because it prioritizes the dog's physical health and safety, aligning with the core ethical responsibilities of a professional dog trainer. By considering the specific anatomical features of a breed, e.g., brachycephalic airway issues, joint structure, and their physiological implications, e.g., heat intolerance, recovery from exertion, the trainer can tailor training methods to be safe, effective, and appropriate for the individual dog. This demonstrates a commitment to evidence-based practice and client education, fostering a collaborative relationship built on trust and expertise. Adherence to the Association of Professional Dog Trainers, APT, Code of Ethics, which emphasizes the welfare of the animal and responsible training practices, is paramount. An incorrect approach that ignores or misinterprets basic canine anatomy and physiology presents significant regulatory and ethical failures. For instance, recommending strenuous exercise for a brachycephalic breed without acknowledging their respiratory limitations would violate the APT commitment to animal welfare and could lead to serious health consequences, potentially contravening guidelines related to preventing animal harm. Similarly, suggesting training techniques that place undue stress on a dog's joints without considering their skeletal structure would be irresponsible and could result in injury. Clear breach of ethical conduct. Failing to educate clients about these factors demonstrates a lack of professional competence and a disregard for the dog's well-being. The professional decision-making process for similar situations should involve a thorough assessment of the individual dog, including breed-specific predispositions and any known health issues. This assessment should then inform the selection of training methods and the development of a training plan. Open and honest communication with the client, explaining the rationale behind chosen techniques and any necessary modifications due to the dog's anatomy or physiology, is crucial. When in doubt, consulting with a veterinarian is an essential step to ensure the dog's health and safety are prioritized. Question 12. Cost-benefit analysis shows that client's dog exhibits severe fear of thunderstorms, leading to destructive behavior and distress. The client wants an immediate solution to prevent damage and calm the dog during storms. The trainer has identified a gradual desensitization and counter-conditioning protocol as the most humane and effective long-term strategy, but it requires consistent effort over several months and may not completely eliminate the fear response during intense storms. What is the most ethically and professionally sound course of action for the trainer? Option A. Begin a high-intensity exposure program to thunderstorms, paired with positive reinforcement to rapidly desensitize the dog to the stimulus. Option B. Implement a structured desensitization and counter-conditioning program, educating the client on the process, realistic expectations, and the importance of their consistent participation, while also providing management strategies for immediate relief during storms. Option C. Immediately recommend a sedative from a veterinarian to manage the dog's anxiety during storms, as this offers the quickest and most reliable way to prevent destructive behavior. Option D. Advise the client that the dog's fear is too severe to be effectively managed by training alone, and suggest reharming the dog to a quieter environment. The correct answer is B. Implement a structured desensitization and counter-conditioning program, educating the client on the process, realistic expectations, and the importance of their consistent participation, while also providing management strategies for immediate relief during storms. Explanation. This scenario presents a common challenge for professional dog trainers, managing a client's expectations and ensuring the dog's welfare while addressing significant fear and anxiety. The trainer must balance the client's desire for a quick fix with the reality of behavior modification, which requires time, consistency, and a deep understanding of canine behavior and learning theory. The core of the challenge lies in the trainer's ethical obligation to the animal, which supersedes the client's immediate demands if those demands could be detrimental. The correct approach prioritizes a gradual, evidence-based desensitization and counter-conditioning protocol. This aligns with the Association of Professional Dog Trainers, APT, Code of Ethics, which emphasizes humane training methods, the welfare of the animal, and the importance of science-based practices. By focusing on building positive associations and gradually exposing the dog to the feared stimulus at sub-threshold levels, this method minimizes stress and avoids flooding, which can exacerbate fear and anxiety and potentially lead to aggression. This approach respects the dog's emotional state and promotes long-term behavioral change. An incorrect approach that immediately jumps to aversive techniques or high-intensity exposure without proper preparation fails to adhere to ethical guidelines. Such methods can cause significant distress, damage the human-animal bond, and potentially lead to learned helplessness or increased fear aggression, violating the APT commitment to avoiding harm. Another incorrect approach might be to simply tell the client it's impossible to fix, neglecting the trainer's duty to explore all humane and effective options and provide guidance. This demonstrates a lack of professional commitment and expertise. A third incorrect approach could be to overpromise rapid results, setting unrealistic expectations, and potentially leading to the client discontinuing training prematurely or resorting to harmful methods out of frustration. This violates the principle of honesty and transparency. The professional decision-making process for such situations involves 1. Thorough assessment of the dog's fear and anxiety triggers, intensity, and history. 2. Collaborative goal setting with the client, emphasizing realistic timelines and the importance of their consistent participation. 3. Developing a tailored, humane, and science-based training plan that prioritizes the dog's emotional well-being. 4. Continuous monitoring of the dog's response and adjusting the plan as needed. 5. Educating the client about the process, potential setbacks, and the importance of patience and consistency. Question 13. Research into how a client's dog is exhibiting increased reactivity towards other dogs during walks, with the client reporting the dog copies their own tension when seeing another dog, suggests a potential application of social learning theory. What is the most appropriate initial approach for a certified professional dog trainer to take in this situation? Option A. Conduct a comprehensive behavioral assessment, observing the dog's interactions and the client's body language during leash walks to understand the dynamics of the observed behavior and the potential influence of social learning. Option B. Suggest the client ignore the dog's behavior and focus solely on positive reinforcement for calm behavior when no other dogs are present. Option C. Immediately recommend a muzzle and aversive training techniques to suppress the reactive behavior. Based on the client's description of the dog copying tension. Option D. Advise the client to avoid all other dogs until the behavior is resolved, without further assessment of the underlying causes or the client's role. The correct answer is A. Conduct a comprehensive behavioral assessment, observing the dog's interactions and the client's body language during leash walks, to understand the dynamics of the observed behavior and the potential influence of social learning. Explanation. This scenario presents a common challenge for professional dog trainers, applying theoretical knowledge to real-world client situations while adhering to ethical guidelines and best practices. The core difficulty lies in balancing the client's immediate goals with the long-term welfare and learning of the dog, particularly when the client's understanding of canine behavior may be limited. Careful judgment is required to interpret the client's observations and translate them into effective, humane training strategies. The correct approach represents best professional practice because it prioritizes understanding the underlying reasons for the dog's behavior through observation and analysis, aligning with the principles of evidence-based training and the Association of Professional Dog Trainers, apt Code of Ethics. This approach emphasizes a collaborative relationship with the client, empowering them with knowledge and skills while ensuring the dog's well-being. It directly addresses the application of social learning theory by seeking to understand how the dog might be learning from its environment and interactions, including those with the client. An incorrect approach that immediately suggests a specific intervention without thorough assessment fails to uphold the apt commitment to humane and effective training methods. It risks misinterpreting the dog's behavior, potentially leading to ineffective or even detrimental training interventions. Ethically, this approach bypasses the crucial step of a comprehensive risk assessment and individualized behavior analysis, which are fundamental to responsible professional practice. Another incorrect approach that dismisses the client's observations without investigation undermines the client-trainer relationship and fails to gather potentially vital information about the dog's learning history and environmental influences, which are key components of social learning theory. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement with the client. This is followed by a thorough behavioral assessment, which includes observing the dog in its environment and gathering detailed history. Based on this comprehensive understanding, the trainer can then develop a tailored, humane, and effective training plan that considers the principles of social learning theory, focusing on how the dog learns through observation, imitation, and reinforcement. This systematic approach ensures that interventions are appropriate, ethical, and aligned with the apt standards. Question 14. Examination of the data shows a client reporting their dog exhibits sudden, intense barking and lunging at strangers entering their home, often accompanied by growling. The client is seeking immediate solutions to stop this behavior. What is the most appropriate initial step for a certified professional dog trainer? Option A. Conduct a thorough risk assessment to evaluate the potential for aggression and determine if the behavior requires referral to a veterinary behaviorist. Option B. Suggest the client ignore the behavior and hope it resolves on its own over time. Option C. Immediately implement a standard desensitization and counter-conditioning protocol for greetings. Option D. Advise the client to use a muzzle and leash consistently when visitors are present to prevent any incidents. Correct answer is A. Conduct a thorough risk assessment to evaluate the potential for aggression and determine if the behavior requires referral to a veterinary behaviorist. Explanation. This scenario presents a professional challenge because it requires a dog trainer to assess a behavioral problem with potential safety implications, necessitating a thorough risk assessment before implementing any training plan. The trainer must balance the client's desire for a quick fix with the ethical and professional obligation to ensure the safety of the dog, the client, and the public. The Association of Professional Dog Trainers certification framework emphasizes evidence-based practices and a commitment to animal welfare, which includes a proactive approach to identifying and mitigating risks associated with behavioral issues. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment. This aligns with the ethical guidelines of the Association of Professional Dog Trainers certification, which mandate that trainers act in the best interest of the animal and the public. A thorough risk assessment allows the trainer to identify potential dangers, such as aggression or severe anxiety, and to determine if the problem is beyond the scope of their expertise, requiring referral to a veterinary behaviorist or other qualified professional. This proactive measure prevents potentially harmful training interventions and ensures that the client receives appropriate guidance. An incorrect approach that involves immediately implementing a standard positive reinforcement protocol without a prior risk assessment fails to acknowledge the potential severity of the behavioral problem. This could lead to a situation where the chosen intervention is ineffective or even exacerbates the issue, potentially increasing the risk of harm. Ethically, this is a failure to adequately protect the animal and the public. Another incorrect approach, such as recommending aversive techniques to suppress the behavior quickly, directly violates the principles of humane training and the ethical standards of the Association of Professional Dog Trainers certification, which advocates for positive, science-based methods. This approach risks causing fear, anxiety, and further behavioral deterioration. A third incorrect approach, which is to dismiss the client's concerns as minor without proper investigation, is a failure in professional diligence and could lead to an unaddressed behavioral problem escalating into a more serious and dangerous situation, representing a significant ethical lapse. Professionals should approach such situations by first gathering detailed information about the behavior, its triggers, and its history. This should be followed by a direct observation of the dog, in its environment if possible. Based on this information, a formal risk assessment should be conducted to evaluate the potential for harm. If the risk is deemed high or the behavior is complex, the professional should consult with or refer the client to a veterinary behaviorist or other appropriate specialist. If the risk is manageable, a tailored, humane training plan can be developed, with clear communication to the client about expectations and progress. Question 15. Market research demonstrates that separation anxiety is a prevalent concern among dog owners seeking professional training assistance. A client reports their dog, a 2-year-old Labrador Retriever, exhibits destructive chewing, excessive barking, and house soiling exclusively when left alone for more than 30 minutes. The dog is otherwise well behaved and shows no signs of anxiety when the owner is present. The owner is seeking a quick fix and has expressed interest in methods that will immediately stop the unwanted behaviors. Considering the apt ethical guidelines and best practices for addressing separation anxiety, which of the following represents the most appropriate initial course of action for a certified professional dog trainer? Option A. Suggest the owner administer over-the-counter calming supplements and leave the dog with a single chew toy, as this is often sufficient to manage mild separation anxiety. Option B. Recommend that the owner immediately begin leaving the dog alone for progressively longer durations, starting with several hours, to help the dog get over it. Option C. Advise the owner to use a bark collar and confine the dog to a crate for extended periods whenever they leave the house, as this will deter the unwanted behaviors. Option D. Implement a structured desensitization and counter-conditioning program, starting with very short durations of alone time and gradually increasing it, while simultaneously teaching the dog to associate the owner's departure cues with positive experiences. The correct answer is D. Implement a structured desensitization and counter-conditioning program, starting with very short durations of alone time and gradually increasing it, while simultaneously teaching the dog to associate the owner's departure cues with positive experiences. Explanation. This scenario presents a common yet complex challenge for professional dog trainers, addressing separation anxiety in a way that is both effective for the dog and compliant with professional standards. The challenge lies in the nuanced nature of separation anxiety, which can stem from various underlying causes and manifest in diverse ways, requiring a tailored, multifaceted approach rather than a one-size-fits-all solution. Professional judgment is crucial to differentiate between true separation anxiety and other behavioral issues, and to implement interventions that are humane, evidence-based, and avoid exacerbating the problem. The correct approach represents best professional practice because it prioritizes a thorough assessment and a gradual, positive reinforcement-based desensitization and counter-conditioning program. This aligns with the ethical guidelines of the Association of Professional Dog Trainers (APT), which emphasize humane training methods and a commitment to the well-being of the animal. By starting with a comprehensive history and observation, the trainer can identify triggers and the dog's specific anxiety level. The subsequent gradual introduction of alone time, paired with positive associations, e.g., special treats or toys, directly addresses the fear and distress associated with owner absence. This method is scientifically supported and minimizes the risk of negative side effects. An incorrect approach that relies solely on punishment or aversive techniques would be a significant regulatory and ethical failure. Such methods are explicitly discouraged by the APT and can be detrimental to the dog's welfare, potentially increasing anxiety, fear, and aggression, and damaging the human-animal bond. Another incorrect approach that involves immediate, prolonged alone time without gradual acclimatization would also be ethically unsound. This would overwhelm the dog, likely worsening the anxiety and creating new behavioral problems. Furthermore, recommending over-the-counter calming supplements without veterinary consultation or a comprehensive behavioral plan would be a failure to provide competent professional advice, potentially delaying effective treatment and mismanaging the client's expectations. Professionals should approach such situations by first gathering detailed information about the dog's history, environment, and the specific behaviors observed. This should be followed by a direct assessment of the dog's behavior. Based on this assessment, a personalized, humane, and evidence-based training plan should be developed. This plan should be communicated clearly to the owner, with realistic expectations set regarding the time and effort required. Ongoing monitoring and adjustment of the plan are essential, and collaboration with veterinary professionals should be considered when appropriate, particularly if underlying medical conditions or severe anxiety are suspected. Question 16. To address the challenge of a dog exhibiting subtle signs of nervous system overstimulation, such as increased lip licking, yawning, and a stiffening of its body during a seemingly simple training exercise, which of the following approaches best reflects professional best practice according to the Association of Professional Dog Trainers Certification Framework? Option A. Introduce a mild aversive stimulus, such as a leash pop or a sharp verbal correction, to redirect the dog's attention and break its focus on the perceived stressor. Option B. Continue with the exercise, assuming the dog is being difficult or testing boundaries, and use firm verbal cues to encourage compliance. Option C. Immediately pause the training session, assess the environment for potential stressors, and consider simplifying the exercise or taking a short break to allow the dog to recover before resuming at a lower intensity. Option D. End the training session abruptly without further observation or intervention, assuming the dog is not in the right mood to learn. The correct answer is C. Immediately pause the training session, assess the environment for potential stressors, and consider simplifying the exercise or taking a short break to allow the dog to recover before resuming at a lower intensity. Explanation. This scenario is professionally challenging because it requires the trainer to interpret subtle behavioral cues indicative of a dog's internal physiological state, specifically its nervous system's response to stress or overstimulation. Misinterpreting these signs can lead to ineffective training, potential welfare issues for the dog, and a breakdown in the client-trainer relationship. Careful judgment is required to differentiate between a dog that is simply disengaged and one that is experiencing a significant physiological stress response that could be exacerbated by continued training. The correct approach represents best professional practice because it prioritizes the dog's welfare and employs a science-based understanding of canine behavior and physiology. By recognizing signs of nervous system overload, e.g., lip licking, yawning, whale eye, freezing, panting when not hot, and pausing or modifying the training session, the trainer is acting ethically and in accordance with the principles of humane training. This approach aligns with the Association of Professional Dog Trainers, APT, Code of Ethics, which emphasizes the importance of understanding canine behavior, avoiding punishment-based methods that can increase stress, and ensuring the dog's emotional and physical well-being. It also reflects a commitment to evidence-based practices, acknowledging that a dog's nervous system plays a critical role in its ability to learn and cope with its environment. An incorrect approach that involves pushing the dog through its discomfort, assuming it is being stubborn or disobedient, represents a significant ethical failure. This disregards the dog's physiological state and can lead to increased anxiety, fear, and potentially the development of more severe behavioral problems. Such an approach violates the APT commitment to humane treatment and could be seen as a failure to uphold professional standards of care. Another incorrect approach, such as immediately ending the session without attempting to de-escalate or understand the cause of the stress, while seemingly prioritizing the dog's immediate comfort, may be professionally insufficient. While stopping is good, failing to analyze the situation and adapt future training plans based on the observed stress response misses an opportunity for effective, welfare-focused training. It suggests a lack of diagnostic skill in interpreting the dog's nervous system signals. A third incorrect approach, which might involve applying aversive techniques to snap the dog out of it, is a severe ethical and regulatory failure. This directly contradicts humane training principles and the APT stance against punishment. Such methods can cause significant psychological harm, suppress natural behaviors, and damage the dog's trust in the trainer and owner, leading to a negative association with training and potentially the handler. The professional decision-making process for similar situations should involve a continuous assessment of the dog's body language and physiological state. Trainers should be educated in recognizing subtle signs of stress and overstimulation. When these signs appear, the professional response is to pause, assess the environment and the training exercise, and modify the approach. This might involve simplifying the task, reducing distractions, taking a break, or ending the session on a positive note if the dog is receptive. The goal is always to create a positive learning experience that respects the dog's emotional and physiological capacity. Question 17. Analysis of a client's request to immediately stop their 5-month-old puppy from sniffing and exploring during walks, as they find it time-consuming, and want the puppy to walk nicely like an adult dog, presents an ethical dilemma for a professional dog trainer. Considering the critical developmental stage of the juvenile period, which approach best aligns with professional best practices and ethical guidelines? Option A. Suggest the client wait until the puppy is at least a year old before focusing on loose-leash walking, as puppies are too young to learn such advanced behaviors. Option B. Advise the client to use aversive tools or techniques to quickly suppress the puppy's sniffing and exploration, as this will achieve the desired outcome of a nicely walking dog more efficiently. Option C. Agree to the client's request and immediately implement strict training protocols to eliminate all sniffing and exploration on walks, prioritizing the client's immediate satisfaction over the puppy's developmental needs. Option D. Educate the client on the importance of sniffing and exploration for a juvenile dog's cognitive development and well-being, and propose management strategies and positive reinforcement techniques to gradually teach loose-leash walking, while still allowing for natural behaviors. The correct answer is D. Educate the client on the importance of sniffing and exploration for a juvenile dog's cognitive development and well-being, and propose management strategies and positive reinforcement techniques to gradually teach loose-leash walking, while still allowing for natural behaviors. Explanation. This scenario presents a professionally challenging situation because it requires a trainer to balance the immediate needs of a client with the long-term developmental needs of a juvenile dog. The juvenile period is a critical socialization and learning window, and interventions during this time can have lasting impacts. The challenge lies in discerning when a client's request, while seemingly reasonable from their perspective, might inadvertently hinder the dog's development or create future behavioral issues. Careful judgment is required to educate the client and propose solutions that align with ethical training practices and the dog's welfare. The correct approach represents best professional practice because it prioritizes the dog's developmental needs and employs evidence-based, humane training methods. It involves open communication with the client, educating them about the significance of the juvenile period, and collaboratively developing a training plan that addresses the client's concerns without compromising the dog's socialization or learning. This aligns with the Association of Professional Dog Trainers, APT, Code of Ethics, which emphasizes the trainer's responsibility to promote the welfare of the animal and to use humane and effective training methods. Specifically, it upholds the principle of do no harm by avoiding potentially detrimental training techniques and advocating for positive reinforcement and management strategies that support healthy development. An incorrect approach that focuses solely on appeasing the client without considering the dog's developmental stage is professionally unacceptable. This could lead to the client implementing methods that suppress natural behaviors or create anxiety, which are ethical failures. For instance, using punishment-based methods to quickly stop a juvenile dog from exploring or interacting with its environment during this crucial period can lead to fear, aggression, or a lack of confidence later in life. This violates the APT commitment to humane treatment and could be seen as a failure to act in the best interest of the animal. Another incorrect approach that involves delaying any intervention until the dog is older ignores the critical nature of the juvenile period for socialization and habituation. This can result in missed opportunities for positive learning experiences, potentially leading to more entrenched behavioral issues that are harder to address later. Ethically, this represents a failure to provide timely and appropriate guidance, potentially allowing negative patterns to develop. The professional decision-making process for similar situations should involve a thorough assessment of the dog's age, developmental stage, and the client's goals and concerns. It requires active listening, empathetic communication, and the ability to translate scientific understanding of canine behavior and development into practical advice for the client. Trainers should always advocate for methods that are humane, effective, and promote a strong, positive relationship between the dog and its owner, while also educating clients about the importance of early socialization and appropriate management strategies. Question 18. Market research demonstrates that many new puppy owners are hesitant to expose their young dogs to new environments and other animals due to concerns about disease transmission and potential negative interactions. A client expresses significant anxiety about their 10-week-old puppy's socialization, stating they want to wait until the puppy is fully vaccinated before engaging in any significant social exposure beyond their immediate household. As a certified professional dog trainer, how should you best advise this client to ensure the puppy's optimal development during this critical socialization period? Option A. Educate the client on the critical importance of the socialization window, explaining that the risks of under-socialization, leading to fear, anxiety, and potential aggression, often outweigh the manageable risks of appropriate, controlled socialization. Propose a plan that includes safe, positive exposures to various sights, sounds, people, and vaccinated, healthy dogs in controlled settings, while discussing strategies to mitigate disease risk with their veterinarian. Option B. Recommend a broad, unstructured approach to socialization, encouraging the client to take the puppy to busy public places as much as possible to maximize exposure, regardless of vaccination status or potential for overwhelming experiences. Option C. Agree to the client's request to delay all significant socialization until the puppy is fully vaccinated, focusing solely on basic obedience commands within the home environment during this period. Option D. Gently dismiss the client's concerns as overblown and proceed with a standard socialization checklist without addressing their specific anxieties or discussing veterinary recommendations for safe exposure. Correct answer is A. Educate the client on the critical importance of the socialization window, explaining that the risks of under-socialization, leading to fear, anxiety, and potential aggression, often outweigh the manageable risks of appropriate, controlled socialization. Propose a plan that includes safe, positive exposures to various sights, sounds, people, and vaccinated, healthy dogs in controlled settings, while discussing strategies to mitigate disease risk with their veterinarian. Explanation. Scenario analysis. This scenario presents a common challenge for professional dog trainers, balancing client expectations with scientifically backed best practices, particularly concerning the critical socialization period. Clients may have preconceived notions or anecdotal evidence that conflict with established developmental timelines and the importance of early, positive experiences. The trainer must navigate this by educating the client, advocating for the dog's welfare, and adhering to professional standards without alienating the client. The challenge lies in communicating complex developmental science in an accessible way that empowers the client to make informed decisions aligned with the dog's long-term well-being. Correct approach analysis. The correct approach prioritizes the dog's developmental needs during the critical socialization window. This aligns with the core principles of professional dog training, which emphasize humane, evidence-based methods that promote positive behavior and well-being. By recommending a structured, positive socialization program tailored to the puppy's age and temperament, the trainer is acting ethically and professionally. This approach directly addresses the scientific understanding of canine development, where early positive exposures are crucial for preventing fear-based behaviors and promoting adaptability. This is consistent with the ethical guidelines of the Association of Professional Dog Trainers, APT, which advocate for the welfare of the animal and the use of science-based training methods. Incorrect approaches analysis. One incorrect approach involves delaying socialization due to the client's fear of illness. This fails to recognize that the risks of under-socialization leading to fear, anxiety, and aggression often outweigh the manageable risks of appropriate socialization in a controlled, safe environment. Ethically, this approach prioritizes convenience or fear over the dog's developmental needs, potentially causing long-term behavioral issues. It also disregards the apt emphasis on proactive behavior modification and prevention. Another incorrect approach is to dismiss the client's concerns and proceed with a generic, potentially overwhelming socialization plan. This demonstrates a lack of empathy and poor client communication, which are essential components of professional practice. It also fails to acknowledge that individual puppies have different temperaments and needs, and a one-size-fits-all approach can be detrimental. Professionally, this can lead to client dissatisfaction and a breakdown in the trainer-client relationship, undermining the trainer's credibility. A third incorrect approach is to agree to a plan that significantly deviates from best practices, such as focusing solely on obedience commands, without addressing broader social exposure. This prioritizes appeasing the client over the dog's comprehensive development. It ignores the crucial role of varied positive experiences with different people, environments, and other appropriate dogs during the socialization period, which is fundamental to preventing future behavioral problems. This approach is ethically questionable as it compromises the dog's welfare for the sake of client satisfaction. Professional reasoning. Professionals should first actively listen to and validate client concerns. Then, they should clearly and empathetically explain the scientific basis of the socialization period, emphasizing the critical window for development and the long-term benefits of early positive experiences. They should then propose a tailored, safe, and manageable socialization plan that addresses the client's specific anxieties, e.g., suggesting vet-approved methods for safe exposure to public spaces before full vaccination or controlled introductions to known, healthy dogs. The decision-making process involves prioritizing the animal's welfare, adhering to evidence-based practices, maintaining open and honest communication, and collaboratively developing a plan that balances client needs with the dog's developmental requirements. Question 19. Benchmark analysis indicates that a client is seeking rapid elimination of a dog's mild reactivity towards other dogs during walks, expressing frustration with the current pace of progress and suggesting the use of aversive tools. As a certified professional dog trainer adhering to the Association of Professional Dog Trainers certification framework, how should you approach this situation to ensure both effective behavior modification and ethical practice? Option A. Advise the client that their expectations are unrealistic and that reactivity cannot be effectively managed without significant owner commitment. Then proceed with a training plan that the client may not fully understand or agree with. Option B. Immediately implement a training plan that incorporates aversive tools, such as prong collars or electronic collars, to quickly suppress the reactivity, as the client has requested and is willing to pay for immediate results. Option C. Focus solely on management strategies, such as avoiding all other dogs, without educating the client on proactive training techniques or addressing the underlying emotional state of the dog. Option D. Explain the principles of positive reinforcement and counter-conditioning, detailing how these methods, while potentially slower, build a positive association and address the root cause of reactivity without compromising the dog's welfare or the trainer-client relationship, and propose a revised, client-friendly plan. The correct answer is D. Explain the principles of positive reinforcement and counter-conditioning, detailing how these methods, while potentially slower, build a positive association and address the root cause of reactivity without compromising the dog's welfare or the trainer-client relationship, and propose a revised, client-friendly plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the trainer to balance the immediate need for a behavior change with the long-term ethical implications of their training methods. The client's desire for rapid results can create pressure to use less humane or potentially harmful techniques, which could lead to unintended negative consequences for the dog's welfare and the trainer's professional reputation. Careful judgment is required to ensure that training aligns with established ethical guidelines and promotes a positive relationship between the dog and owner. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the dog's welfare and employs scientifically validated, humane training methods consistent with the Association of Professional Dog Trainers (APT) Code of Ethics. This approach emphasizes positive reinforcement, which is known to build trust, strengthen the human-animal bond, and achieve lasting behavior modification without causing fear, anxiety, or pain. It also involves educating the client on the principles of operant conditioning, empowering them to understand and apply these methods effectively and ethically. This aligns with the APT commitment to promoting humane and effective training practices. Incorrect approaches analysis. One incorrect approach involves solely relying on punishment-based techniques to suppress the unwanted behavior. This fails to address the underlying cause of the behavior and can lead to a range of negative side effects, including increased fear, aggression, and a breakdown of the human-animal bond. Ethically, this violates the APT commitment to humane treatment and can be detrimental to the dog's psychological well-being. It also fails to educate the client on positive, sustainable solutions. Another incorrect approach is to ignore the client's request and proceed with a training plan that the client does not understand or agree with. While the trainer's expertise is valuable, A lack of client buy-in and understanding can lead to inconsistent application of the training plan at home, rendering the professional intervention ineffective. This also undermines the collaborative nature of professional training and fails to meet the client's needs for education and guidance. A third incorrect approach is to implement a training plan without thoroughly assessing the dog's individual history, temperament, and the specific environmental factors contributing to the behavior. This can lead to a misdiagnosis of the problem and the application of inappropriate techniques, potentially exacerbating the issue or creating new ones. This demonstrates a lack of due diligence and a failure to adhere to best practices in behavior assessment, which are foundational to effective and ethical training. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive assessment of the dog and its environment. They should then engage in open and honest communication with the client, explaining the rationale behind their proposed training plan, emphasizing humane and evidence-based methods. The trainer's role is to educate and empower the client, fostering a partnership built on trust and shared understanding of the dog's needs and the principles of operant conditioning. When faced with client pressure for quick fixes, the professional must firmly advocate for the dog's welfare and explain the long-term benefits of humane, ethical training, drawing upon their expertise and the established ethical guidelines of their professional organization. Question 20. What factors determine the most appropriate and ethical intervention strategy for a dog exhibiting aggression towards unfamiliar people in its home environment? Option A. The trainer's personal experience with similar breeds, the availability of training equipment, and the owner's willingness to use punishment-based methods. Option B. The frequency of the aggressive incidents, the dog's age, and the owner's desire for a quick fix to the problem. Option C. The dog's breed, the owner's perceived ability to follow instructions, and the perceived severity of the bite incident. Option D. A comprehensive assessment of the dog's history, environmental factors, specific triggers for aggression, and the dog's underlying emotional state. Correct answer is C. The dog's breed, the owner's perceived ability to follow instructions, and the perceived severity of the bite incident. Explanation. Scenario analysis. This scenario is professionally challenging because aggression in dogs is a complex behavior with multiple contributing factors, and the safety of both the dog and the public is paramount. A trainer must accurately assess the root cause of the aggression to develop an effective and ethical intervention plan. Misinterpreting the triggers or motivations behind the aggression can lead to ineffective training, potential harm, and legal or ethical repercussions. The trainer's responsibility extends beyond simply modifying behavior. It includes understanding the dog's welfare and the owner's capacity to manage the situation. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. This involves gathering detailed history, observing the dog and its environment, and understanding the specific context in which aggression occurs. This aligns with the ethical guidelines of professional dog training organizations, which emphasize evidence-based practices, humane treatment, and client education. A thorough assessment allows for the identification of underlying medical issues, environmental stressors, learned behaviors, or a combination thereof, which is crucial for developing a safe and effective behavior modification plan. This approach upholds the trainer's duty of care to the dog, the owner, and the community. Incorrect approach is analysis. One incorrect approach would be to immediately implement aversive training techniques without a thorough assessment. This is ethically unacceptable as it can exacerbate fear and anxiety, potentially leading to increased aggression or the suppression of warning signals, making the dog more dangerous. It violates the principle of humane treatment and can be considered a failure to act in the best interest of the animal. Furthermore, it fails to address the root cause of the aggression, making it an ineffective long-term solution and potentially leading to a breach of professional standards by not providing competent advice. Another incorrect approach would be to solely focus on punishment for aggressive displays, ignoring any potential underlying causes or triggers. This is a reactive and potentially dangerous strategy. Ethically, it disregards the dog's welfare and fails to consider the impact of the environment or the dog's emotional state. Professionally, it demonstrates a lack of understanding of canine behavior and a failure to adhere to modern, science-based training methodologies that advocate for positive reinforcement and management strategies. This approach can also lead to legal liabilities if the dog's condition worsens or causes harm due to the trainer's inadequate intervention. A third incorrect approach would be to recommend immediate euthanasia based on a single aggressive incident, without exploring all possible behavioral modification and management strategies. This is an extreme measure that should only be considered as a last resort after all other avenues have been exhausted, and in consultation with veterinary professionals. Ethically, it represents a failure to advocate for the animal's well-being and a premature abandonment of professional responsibility. It also fails to meet the standards of care expected from a certified professional who is trained to explore behavioral solutions. Professional reasoning. Professionals should approach aggression cases by first establishing a clear understanding of the dog's history and current environment. This involves detailed questioning of the owner, observation of the dog's body language and interactions, and potentially a veterinary check to rule out medical causes. The next step is to identify specific triggers and the function of the aggressive behavior. Based on this comprehensive assessment, a tailored behavior modification plan should be developed, prioritizing safety through management techniques and employing humane, positive reinforcement-based training methods. Continuous monitoring and adjustment of the plan are essential, with clear communication and education provided to the owner. If the aggression is severe or poses an unmanageable risk, consultation with a veterinary behaviorist or referral to appropriate services should be considered.